Hey, Kenya, do you see your last name Chaney or Chaney?
Chaney, sorry, Chaney.
Okay, no problem.
Mm-hmm.
Okay, everyone, we're streaming live on Facebook right now, so we're going to give it a couple of minutes. We've got quite a few people that are going to be joining the webinar, so we're going to wait 1 or 2 minutes, and then Angel, when you think we're about ready, I'm going to have you give us the high sign to get started, okay?
No problem. When we're getting ready to go, you'll see the screen take over, and that'll be your cue as we let everybody file in right now. Welcome, everybody. We're going to be starting in a few minutes, so just go ahead and hang on tight.
Okay, we're going to give it about a minute, so we're letting our participants start to zoom in right now, and it's webinar style, as I mentioned before, so you won't be able to see everyone, but we're going to give it a minute or so as they start streaming in, and again, we're also on Facebook Live, so just give us a minute and we'll get started. Okay, I'm going to get started. So welcome everyone to a very special Lunch and Learn today. It's our first annual healthcare symposium. I'm Stephanie Immelman, and I'm the CEO of the Delray Beach Chamber. So I'm just going to start off with a couple of quick chamber announcements. And the very first thing I want to do is to thank our sponsors, because without our sponsors, we wouldn't be able to make this happen. So first of all, I'd like to thank Bethesda Hospital East, that's Baptist Healthcare, for being our presenting sponsor, so you're going to get to hear from them. I'd also like to thank a new member, Derma Vitality and Ultimate Vitality, for being a sponsor today, as well as All About Florida Homes, Lang Realty, and of course, CDS International Holdings. So those are our main sponsors today, and we thank them very much for sitting in with us. We also always have to thank Center State Bank and Cranes Beach House. Those are our marketing and programming annual sponsors at the Delray Beach Chamber. So thank you very much to all of our sponsors, and we're going to be introducing all of our panelists in a few minutes. So I have a few chamber announcements for you, some things that are coming up between now and the end of the year. We always have our Lunch and Learn webinars at 12:30 on Tuesdays. So next week is going to be Consumer and Business Bankruptcy Overview presented by Canniac Law Offices. So you can zoom into that at 12:30 next Tuesday, November 17th. We're also dipping our toe in the water with some in-person events, and one of the first ones will be our Business and Bagels. That'll be Thursday, November 19th at 8 a.m. at the Hyatt Place. We'd ask everyone to RSVP ahead of time, so we won't have a check-in line, and of course we'll be socially distanced. So we thank Courtyard by Marriott and Hyatt Place for being our annual sponsors for Business and Bagels. I'm very excited about this one. We love to have our annual legislative lunch. It's one of the highlights that we have of the year. So our elected officials that represent us in Tallahassee usually join us for an actor's studio style interview. Michael Weiner from SSC Law Firm is going to be moderating again this year. We're holding it at the Loft Hotel, and they have a huge ballroom that seats 300, but we're limiting the amount of people that can come so we can remain socially distanced. But it's really a highlight of the year, and we can hope you'll join us that day. So it's always a Tuesday before Thanksgiving, because that's when the legislators are in town to meet their constituents. So it'll be Tuesday, November 24th at 11:30 a.m. at the Loft And so just go to delraybeach.com/events to sign up, and I hope you can join us. Our First Friday Forum, our Government Affairs and Economic Development First Friday Forum, is going to take place on December 4th, and we're going to hear from Mark Barron from the Delray Beach Open. So that's going to be an exciting speaker. And if you haven't joined us for these before, they're free and open to the public. And you'll also hear from representatives from the city of Delray Beach, from the CRA, from the DDA, from the police department, from the fire department. You get a monthly update from all those departments. So if you haven't joined us before, you must do so. You just have to pre-register. It's free, and you can join us on the first Fridays via Zoom. And this is what I'm really excited to talk about. We didn't get to have our annual event that we normally do at the Chamber, our annual business awards, but we're going to do it at the end of the year this year. It's been a heck of a year. So in addition to our Business of the Year Award and Business Person of the Year Award and Nonprofit Awards, we're going to open this up to awards for our hometown heroes. So we're going to be giving awards for our Inspirational Leader of the Year, of our First Responder of the Year, Educator of the Year, Healthcare Professional of the Year. So between now and the end of this week on Friday, please send your nominations for all of those categories to chamber@delraybeach.com. And then next week, we're going to give everybody the chance to vote for their hometown hero. We'll be announcing them on December 9th via Zoom. It'll be a Zoom event, but we'll also afterwards at 6:30 have an in-person Meet the Heroes socially distanced event outdoors at the Sunday House. So mark your calendars for December 9th, and you'll be hearing more from us about our hometown heroes. And I think that's it. So that's what we've got going on between now and the end of the year. So I'm going to turn it over now to Dr. Craig Spodak, and he is our moderator. So I'm going to leave you in very good hands, and I'll have him take it from here. So over to you, Craig, to announce our panelists.
Thank you, Stephanie. Good to be here. Thanks for everybody donating their time to this endeavor. And also thank you to the Bethesda Hospital for making this happen. I do want to take a moment to introduce, I think the first thing to introduce is our key speaker, the former mayor, Jeff Perlman, personal friend, amazing human being, and also now COVID survivor. You get to add that to your long list of accomplishments. For those of you who don't know, Jeff had a very personal and long struggle with it. And we're honored to have you here. It is really good to see your face. We've all missed you, and we're all praying for you. And it's just really special for me to be here with you today. So Jeff, we're going to go ahead and have you tell your story and what you'd like to speak to the audience, and we'll take it from there.
Thank you, Dr. Craig. I want to thank the Chamber for giving me the opportunity to share my story with everyone today. It's a privilege to share my experience, because I hope that by raising awareness, maybe we can, in a small way, do our part to save lives and keep the people we love safe and healthy. My goal today is to give you a glimpse of my COVID experience. I'm just one of 10 million cases in America, and my hope is that I can make those statistics a little more real. They are more than numbers on a TV screen. They are real people, and they are suffering. I did not have a common case. I had a severe one. But while my experience may be statistically unlikely, it is possible to get very sick. This virus is real, and it is dangerous. But as bad as it was for me, it could have been worse. We have lost more than 234,000 Americans to this virus. That is a staggering number. And while I got sick in the July surge, we are in the midst of an even worse outbreak now. So I can't emphasize enough how important it is to be careful and to follow the advice of the experts. Because while I survived and I'm feeling much better, I do have lingering problems. Like me, there are potentially millions of others who continue to suffer symptoms and long-haul impacts on their health. My friends, if I can emphasize anything, you don't want this virus. My COVID experience was a nightmare. There's really no other word for it. There were entire days and nights where I did not believe that I was going to survive. And that is an emotional experience that I never anticipated. Don't wish on anyone, and I'm still trying to process. I want to paint a picture of where I was pre-COVID. I had been working remotely for months. I wore a mask. I socially distanced. I washed my hands a lot. I stopped going to the gym, but did work out with a trainer in a friend's garage. I did go to restaurants. I wanted to support our local businesses. I was a month and a half short of my 56th birthday when I went to Bethesda Hospital on Friday, July 10th to get a rapid test because I was feeling tired and was running a slight fever. I'd actually gone into my office that day for the first time for a brief meeting where I sat 6 feet away from a colleague. Those who saw me said I looked very tired. I went home and took a nap. When I woke up, I felt warm. My wife, Diane took my temperature, and I was running a slight fever. I wanted to take a Tylenol and go back to bed. My wife insisted that I call my doctor. She didn't want to take a chance since we were heading into the weekend. That was my first break. I called Dr. Paige Morris, and she insisted that I go to Bethesda for a rapid test. I said a quick goodbye to Diane and left for the hospital, not knowing that I wouldn't see her for 39 days. At Bethesda, I was diagnosed with COVID-19 and told that I had double pneumonia. Within hours, I was struggling to breathe. I am convinced had I not gone to the hospital, I would not have made the night. I was that sick. Getting a bad case of COVID, one that spreads to your lungs, is like getting hit by a truck that repeatedly backs over you. That night began a nearly 6-week battle to survive, with every breath labored, every part of your body weak and in pain, and a feeling that there is no way out, no way back to your life and your loved ones. I had what was described as a violent case of pneumonia that was ravaging my lungs. I have mild asthma, and this virus seems to attack where you are most vulnerable. There were at least 2 times where I felt I was going to die, and I had this one recurring thought, and it was about my late mother, who we lost to cancer at age 59. In the 22 years since her passing, as my children grew up, as birthdays passed, as good and not so good things happened to those she loved, I always thought about how much she missed. She never met my wife, Diane, the love of my life. She didn't get to see her grandchildren grow up, and she didn't get to meet Diane's boys. In short, she was robbed of our greatest gift, time. And now here I was, 4 years younger, thinking that I won't even make it to her age, and how much of life I will miss as a result. I thought of all the people I love, many on this call, and how I never got to say goodbye or to sit down with each and every one of them and tell them what a gift they have been to my life. There was a night in the ICU where I could tell by the sense of urgency that my nurses seemed to have as they hovered over me that I was in real trouble. I don't remember too much. I was very weak, but I remember this urge to let go. It was as if the virus was beckoning to me. I can't explain it, but it was palpable. And I felt that I needed to make a choice. I could let go, that seemed to be the easy route, or I could fight. And I decided that night to fight. I wasn't sure that I could win, but I wasn't going to let go. I just wasn't going to let go. I prayed a lot, and I concentrated on every breath. Breathe in, breathe out. I felt like I was suffocating. I just couldn't get air. And that is a horrifying experience. As the days and weeks passed, I was on a variety of oxygen, including a BiPAP mask that felt like putting a hurricane on your face. They strap it on tight and it forces air into your lungs. My eyes burned. I ended up with blood clots and bladder spasms and pain I cannot describe. They gave me morphine and it didn't really dull the pain. The masks are very claustrophobic and I wore the most restrictive ones for up to 7 hours at a time. I feared going to sleep because I wasn't sure I was going to wake up. I only slept when I was exhausted and couldn't stay up anymore. I had some really strange dreams, which is common with COVID. I dreamt that I was wandering Delray at night with my golden retriever, Teddy, who recently passed, and I dreamt that I was hiding in the hospital. When I woke, the steroids that I was on would sometimes leave me unable to figure out where I was in the room. I thought the TV was on the ceiling. I was completely disoriented. I was so weak I couldn't lift my head or sit up. I often was awakened by screams from my neighbor whose COVID affected her brain and gave her hallucinations. Those screams ended up haunting me because it's just hard to hear a human being going through that and not be able to offer comfort. Being in ICU or a COVID unit is a very unique experience. You are essentially alone for 39 days in my case, 24 hours a day, left to your thoughts, no visitors. The only people you see come dressed in 2 layers of PPE. You can barely see their eyes. I was in 8 different rooms, many with no windows that I could see out of. There was a lot of equipment, and the rooms were something called negative pressure. The hospital air couldn't get in and my air couldn't get out. It was loud and it was lonely. Now, I had the most amazing nurses, and my doctor, Paige Morris, came to see me every single day, which is also amazing. Dr. Morris served as my quarterback and advocate, answering questions, holding my hand, reassuring me, keeping my spirits up, and just chatting, because the nurses are so busy and overwhelmed that when they come in, they have to focus on all those wires sticking in your arms and glued to your chest. I can't say enough about Dr. Morris and my pulmonologist, Dr. Naveen Karp, who also came by to listen to my lungs every day. The staff at Bethesda is so good. They are truly remarkable. They save me. We are so blessed to have these healthcare professionals in our community. They are heroes, and right now and for much of this year, they have been under fire and stress to the absolute max. We have to, as a society, consider their needs and listen to their advice. It's not enough to have an I love nurses bumper sticker. We have to do what we can to support them and try our best to keep infections under control. My case hit the news, and it's not because I'm special. So many other cases worse than mine go unreported, but I suppose my being a former mayor of Delray was newsworthy. We are a small town, and I knew some of the hospital staff, and they knew me. A few of them came by for quick hellos, which I loved. I had one young nursing assistant who actually spent her breaks in my room talking to me about her boyfriend, her dreams to further study medicine, and the fact that I must have seen her dance at Delray's Cinco de Mayo festival when she was a little girl and I was mayor. That young woman was a gift from God. She raised my spirits just by allowing me to be a real person for 15 minutes here and there. Early on, I decided that I wanted to communicate as best I could to the outside world about what COVID was like. So I saved up my strength, and once a day I would post an update on Facebook. The response was wonderful. Soon prayer groups formed, and I think I heard from most everyone I've ever met. Old friends from childhood, former teachers, people I've worked with. It was wonderful, and their prayers and kind words saved me. I'm so grateful and so blessed. I do believe in the power of prayer, and when prayer and medical angels get together, you get to live. You get another shot at life. While at Bethesda, I received state-of-the-art medical care. 2 doses of convalescent plasma, thanks to an overwhelming response from the community to donate. I had steroids to help me breathe. I got a course of remdesivir, lots of vitamin D and zinc, and round-the-clock monitoring by wonderful doctors and nurses. I made it out after 39 days. I came home on oxygen, weak, and using a walker. Lots of therapy, hard work, love, prayers, medical skill, family, and friends are helping me get back to being myself. My lungs are scarred, but they are healing. I have headaches every day. I'm very sore. I have some brain fog and lots of pain in my left leg and my right arm, which makes sleeping difficult. I've even experienced some hair loss. I think it's important to share that I am getting counseling because I have what they call survivor's guilt and a touch of anxiety, actually maybe more than a touch. I know I was saved for a reason, and I'm working hard to figure out how I can make the most of my second chance. I love my friends and my family even more, and words cannot express what Diane has meant through my illness and my recovery. Every moment of every day, I was determined to survive so that I could come home to this wonderful love that we have found. I'm worried about lingering impacts. COVID is a vascular disease, and there's still so much they don't know. Sometimes I get frustrated when I'm winded after a short walk, but I remember that when I came home, I worried about how I was going to walk from the car into my house. Now I can walk a mile. I'm so grateful I was spared. So many aren't. If you take anything away from my story, I hope it's this. COVID is real, and COVID can be deadly. So please, please be vigilant. Let's follow the science. Let's employ common sense and let's support each other during this difficult time, especially our frontline medical professionals and our essential workers. Thank you so much for this incredible opportunity to share my story today. It means the world to me and my family, and I really deeply appreciate the opportunity. Thank you.
Well, thank you, Jeff. That was, it's so hard to watch a dear friend go through something, but you're trying to find the meaning in what you went through, and God's given you such an amazing gift with words. You're a powerful writer, and there's a unique opportunity in your message because you're so skilled at being able to deliver such a powerful message. So you only get what you need in life, and I somehow there's going to be something that comes out of this, whether it's educating the public like we've got potentially thousands of people who are going to be seeing and hearing this, hearing your voice, and I'm just happy that you're okay, and we're still praying for your recovery. But as a leader in the community, a person who's so eloquent, your message is going to be shared even faster and spread further. So you'll be able to help more people who are not taking this as seriously, perhaps, as they should be. It affects everybody so differently. So appreciate you being on and sharing your story.
Thank you.
Right now, we're going to be moving on to a video that has been put together. It's about from Jeff's family, his nurses and his doctors. These are all people that have supported Jeff. So let's go ahead and watch that now.
Saving lives. It's very appreciated. I got great care here, and I'm going to tell the world that you saved me. And I just have so much respect and gratitude for everything that you've done. No words. You guys are the best of the best, and I love you very much.
Sandra, I'm the director of 3 East West. This is Sandy, the manager of 3 East West. We were so honored to care for Jeff Perlman.
Yeah, like Sandra said, we were so honored to care for Mr. Perlman on our unit. We're happy that he was satisfied with our quality of care. We hope he's doing very well.
Hi, my name is Debbie Stoner. I'm the open heart surgical coordinator here at Bethesda. I've been a personal friend of Jeff's for approximately 16 years, and even though I was not directly involved with his care here, I would try to visit him, look through the window, wave hi, just let him know that somebody was here that kind of knew him. I'm just so happy that you're doing great, Jeff, and I'm so glad that your experience here at the hospital was good. And Diane, I always love you guys. If you ever need anything, I'm always here for you, as well as the staff here at the hospital. So congratulations on your successful recovery.
Hi, I'm Dr. Paige Morris. I'm one of the internists here in town, and I'm Jeff Perlman's primary care doctor. Jeff called me the evening that he became sick, and I met him in the emergency department here in Bethesda. He was eventually diagnosed with COVID. He did give me a good scare, but he remained positive throughout his treatment. He was very active with social media, and his friends and family did an excellent job of providing positive feedback, memories, and sharing things that they look forward to doing with him in the future. He made a point to stay connected and ask plenty of questions. We texted each other throughout his care as well, again, which helped him understand what was going on and help him stay positive throughout this whole ordeal. I feel grateful to have been involved in your care, and I'm so happy that you're doing well, and I'll see you soon.
Okay, so now thank you for that. That was a great video, and what a better introduction to our sponsor, our presenting sponsor, Bethesda Hospital. I mean, it's incredible to have a testimony of that magnitude and to see all those people supporting Jeff's care. It was a great honor to the team that served him, and really happy that Bethesda's put this together. So a moment from our presenting sponsor, Bethesda now.
Give us one.
Looks like we might be having
a little
okay,
bit.
1 second. Sure.
Oh dear. we'll get it in a second.
It's great to see the care providers at Bethesda, from the nurses to the doctors like that. I mean, we all, as healthcare providers, we get burnt out often because we forget why we do what we do. We don't get burnt out over how or what, but it's why we do what we do. That fulfills us. So this is going to be from Dr. Goldman, the Chief Medical Officer and Vice President of Medical Affairs at Bethesda Hospital. Thank you.
Hello, my name is Dr. Dan Goldman. I am the Chief Medical Officer and Vice President of Medical Affairs for Bethesda Health. I'm happy to be here with you today, and we are very proud and happy sponsors of this event. We are a 400-bed facility on the east side of the county and an 80-bed facility on the west side, with outpatient services and multiple other areas. This has been a very interesting time and a tough time for all of us, the community and the medical community as well. We at Bethesda have cared for almost 3,000 patients, with over 800 of those patients being hospitalized in our facilities. We have had many heartfelt stories and longer stays, but with the advent of all the new treatments such as remdesivir and the convalescent plasma, we've had some wonderful outcomes. And you will hear about one of those later in this symposium. I'm very proud and honored to represent our 500 plus doctors on the medical staff here at Bethesda, who are always going out of their way for our patients, but in this case have had to put their lives at risk and really to continue to take care of our patients, and they have been outstanding. I also have to give a huge shout out to all of our staff, from EVS to food and nutrition, to security, to the foundation, to imaging, to the lab, to nursing. And without these people, we could not have done this. It truly does take a village to take care of patients, particularly in this special time of the pandemic. We are very proud to be part of Baptist Health of South Florida with our other northern partner, Boca Raton. We have a great presence up here. They have been wonderful during all these times, getting us items that were in critical shortage at other places, help us organize patients. We shared ICU beds between all the facilities and really came together as a team and a family, and I'm proud to be part of that. I have spent many hours out in the floors and in the emergency department and out front to see all the wonderful care that's been given, and I cannot speak highly enough about all the staff and everyone else, how cooperative and helpful they've been, particularly in this time. In addition, the visitors have all been understanding of our policy and our changes, which will continue to change as we can open up things, but everyone has been very understanding. We have developed a robust program with our patient experience team to have iPads located at the units where there be a patient where they cannot see their family in person, and we allow them to have conversations, which has been very special in all these serious times. Just to also let you know what else is going on in the near future at Bethesda Health, we are starting a major campaign of improvement and enlargement of our West Campus, including hospital beds and another office building on the campus. On the east side, what we call our, quote, front door, end quote, i.e. the emergency room, is going to undergo a major transformation, which I think will make flow better and be safer for all concerned. I cannot say it enough how much we appreciate what our community does for us. It makes us better, makes us stronger, and it makes us felt needed and wanted here. We also would like very much to thank the community members who have contributed to our COVID relief funds, who have contributed with food and other supplies, It's been really an outstanding effort to watch. You will hear from a very special COVID survivor from Bethesda, Jeff Perlman, who's the prior mayor of Delray Beach, tell his story and see a video of the team that really took care of him. We want you to know that we are here for you, and we appreciate your support as well. We want to be a resource for healthcare, for information, and anything else we can help with. Thank you again for your time, and we hope you enjoy the symposium.
Okay, so now we're going to go ahead and get into the panelist portion of our symposium here. It's a great honor to introduce the four that are going to be live with us today, but also Dr. Daniel Goldman, who you just heard from, Chief Medical Officer from Bethesda, has a pre-recorded segment, which we'll be listening to as well. So now we're going to take about 1 or 2 minutes. I'm going to give the floor over to each one of our panelists to speak about themselves and their background. What a great discussion we're going to be having, because there's so many different professionals from different parts of our community that can see the multitude and myriad of impacts that COVID-19 has unfortunately had on our community. So I'm looking forward to a really healthy discussion. We have a bunch of questions that have been asked of the from the community, but also if you're listening, you can live right now, you can go ahead and post your question to the chat and hit all panelists, and we'll be able to field those questions. One thing that would be a little bit easier is if you want to ask of a specific person, please ask the question to the panelists, but put the specific panelist name on as well. So first off, I'd like to introduce Dr. Ron Ford from Joe DiMaggio Children's Hospital. Dr. Ford is a board-certified pediatrician with 25 years of experience. He functions as the Chief Medical Officer currently and oversees clinical operations at the DiMaggio Children's Hospital, which is quite a prestigious institution. The pandemic has presented unprecedented challenges to hospitals and healthcare systems, and it's taught a lot about the efficiency and alternative models of care delivery. And he's part of the team at the Memorial Healthcare System that's working to meet the ongoing challenges. So Dr. Ford, go ahead and introduce yourself and take 2 minutes to tell us a little bit about your what you're doing now.
Thank you very much. As you mentioned, I'm the Chief Medical Officer at Joe DiMaggio Children's Hospital. I've been at the hospital for about 7 years and in Florida for 20 years. I'm a general pediatrician by training, and the majority of my career has been in pediatric hospital medicine. So primarily taking care of children who are sick enough to be hospitalized at the children's hospitals that I've had the privilege to work at. You know, our focus in pediatrics with respect to the pandemic has really been to keep kids safe. As I'm sure we'll discuss, kids have fortunately not been as severely affected for the most part as adults, and we've not seen the huge onslaught of very sick young people in our communities. And so our resources at Joe DiMaggio are first and foremost devoted to the children, but we've also been able to devote resources to the healthcare system as a whole in order to further their ability to manage this pandemic that's so severely hit our community this summer. And it looks like, again, we're on the cusp of another surge. So I'm very proud to be here to join this panel. I'm very proud to be a member of the South Florida community and part of the amazing healthcare systems that we have here. So thank you very much.
Thank you, Dr. Ford. We're looking forward to having some really good questions. I'm just reviewing some of the questions that we're going to be talking with you about. I'm really excited about this. Next, we have Kenya Chaney Madison from Healthier Delray Beach. Healthier Delray Beach is a Palm Beach Health Foundation, part of Healthier Together initiative. It focuses on supporting the behavioral health and well-being of the Delray Beach residents. Kenya herself promotes behavioral health, education and awareness, improves access to services and support systems, and provides prevention opportunities. What an important role and responsibility these days, because the infection has shut us all indoors and the behavioral aspects of the patients is incredibly challenging. So Kenya, take a minute or two to introduce yourself to the audience.
Good afternoon, everyone, and a special thank you to the Chamber of Commerce for inviting me to be amongst these esteemed panelists today. I'm honored to sit among you today. And a special word of gratitude to former Mayor Jeff Perlman for his courageous, talking and telling of his story, just showing the world your vulnerabilities and the challenges that you faced through that ordeal. And so my heart is with you for your continued recovery and for your resiliency. I am the Senior Director for Healthier Delray Beach. As Dr. Spodak mentioned, it's an initiative funded through Palm Health Foundation. We are 1/6 of an initiative called Healthier Together. There's 6 communities that comprise Healthier Together, and I get to lead the one here in Delray Beach. I'm a Delray Beach girl, born and raised. My family is are natives as well. And I'm proud of that. And I've served the Delray Beach families for 19 years prior to this role as a school district of Palm Beach County employee. I was a school counselor at Village Academy and Carver Middle School, and then went on to be the social emotional learning specialist at the school district of Palm Beach County before taking on this role. Always been involved with Healthier Delray Beach, but we are the trusted advocate for the behavioral health needs of the community. And that means that the community tells us what they need, and we go out and find the providers to provide it. And throughout this pandemic, it has been the biggest challenge that I've probably overcome in my life. And I was prepared for such a season as this. This work was probably my greatest professional accomplishment. So I'm again happy to be with you today, happy to be amongst these esteemed panelists, and I can't wait to answer some of the questions that have come in. Great questions coming in, and I hope I get to answer every single one. And if I don't, I'm happy to share my contact information and you can call me personally.
Thank you so much, Kenya. Go ahead. You can feel free to put that right in the chat. Anybody wants to put their personal contact information, Kenya, that's awesome. And we're very thankful to have you here in our community. I don't think we could ever imagine a mental and behavioral health crisis of this proportion ever in your wildest dreams or training. So it's good to have you here. Next is a personal friend of mine, my high school friend as well. Dr. Mylissa Graber. She went to my high school. Dr. Mylissa Graber is the owner and CEO of Dr. G's Urgent Care. I've been there many times with my toddlers and children. And she's also a board certified ER physician with over 15 years experience in emergency medicine. She's got an extensive background in emergency medicine, patients getting ER quality care in a beautiful private setting, quickly and affordably, with the goal to keep the patients out of the actual emergency room. So we're thankful to have Dr. Mylissa Graver, as she's known affectionately, Dr. G. Thank you for being here. Take a minute or two and introduce yourself, please.
Thank you, Craig. Very happy to be here. I live in Delray. I've been living here for the last 13 years. I'm an emergency physician. As he said, I did my training at Albert Einstein Medical Center, went to USF for med school, and then trained at Albert Einstein in emergency medicine. And I've been down in South Florida for basically now almost 20 years. I worked in the North Broward Hospital District for the first 6 years, and then I became medical director of the ER at Good Samaritan in West Palm Beach. And then I became the regional director over all of the ER physicians for the Tenet healthcare system, and then over the HCA system. And I took all of that medical knowledge and administrative and decided to go out into the outpatient setting and to put together an urgent care that's kind of special because it's sort of in between an urgent care and a hospital, where because I'm an ER physician, we'll do more than most other places, with the goal of trying to intervene early in the care and prevent what happens to people like Mayor Perlman, and not have that get to that point. So we spend a lot of time doing that, and I'm very excited. COVID was, as you all know, beyond anything that we've all experienced before, between the challenges of not being able to get supplies, of being able to accommodate all the patients that needed testing, that wanted to be seen, that were getting sick and afraid to go to the hospital. But in the end, I think the team, everybody did a really good job. And I think Florida is really a model for other states in how we've handled it. And I think going forward, I think we're going to be moving hopefully in a good direction with this. So I'm excited to be here and looking forward to answering some questions as well.
Thanks, Dr. Mylissa. We're all hopeful of that as well. And our final panelist that's live with us today is Damon Thomas from Inspired Living Delray Beach. So the COVID-19 pandemic has especially impacted the aging population and their caregivers, as we all know. Inspired Living at Delray Beach has quickly adapted to this new senior living landscape, and they're proud to bring out the best in their class-assisted living and memory care services. He's hopeful that he can answer any questions they may have about senior housing and how the industry is safely navigating these new uncharted waters. So, Damon, take a moment and introduce yourself to the panel, to the audience. Sorry, Damon, you're gonna have to unmute yourself.
Thought I was all this time. Thank you, Doctor. It's an absolute pleasure to be here. Thank you, and welcome to all that are in the room and also joining us online. In particular, Mr. Perlman, thanks for sharing your story. It's one heck of a story, and I look forward to getting to know you on a personal level. Thanks for sharing that. I really appreciate that. As said earlier, again, my name is Damon Thomas. I've been in senior living for the last 25 years now. I'm originally from Boston. I moved down here quite some time ago, but now I'm very lucky to live in Delray Beach, Florida. Sorry for you locals, but I've now fallen in love. I'm not going anywhere. I absolutely love this town, and because of that, I've chosen to run Inspired Living at Delray Beach. It's currently under construction. It's on 14100 Via Flora in Delray. It's between Jog and Military, and I'm really excited to introduce you to the community and show it to you all. That being said, I'm looking forward to answering some questions. I've been assisting my parent company, Validus Senior Living, throughout the state of Florida. We've got about 12 communities across the state right now. Another 3 that are currently, one that just opened up in Royal Palm, one that we're opening in Jacksonville, one that we're opening in Rockledge. And I hope to give you a glimpse on what we've done in senior living and what we hope to do further as we move forward. Thank you.
Thank you, Damon. I just wanted to check it. Give me a little hand signal. Was Damon's microphone a little strange, or is that just on my end? Yeah, so Damon, you may want to mute and unmute your microphone. You sounded a little bit robotic Spodak, and I know that's not your real voice. So if you don't mind doing that. Okay, without any further ado, I'm going to go right to some of the questions. Thank you to the community for putting together such amazing questions. This could go on. These questions are just incredible. So in no particular order, I'm going to start off with Dr. Ford. I'm going to try to combine the questions so that you can get the most amount of value. We can get the most amount of value from your time today. So the question goes, what is the latest on infants and toddlers infection rate? That's the question, but I want to combine it into a couple things so I'd like to ask you, what's the latest on the infection rate? And there was that scary, almost like I can't remember what it was, but it was like Hashimoto's maybe. There's something going on with like
the MISC.
Yeah. So we were hearing quite a bit about that at one point. I want you to speak to the infection rate and also that strange symptoms that were relating around COVID as well for children specifically.
So we don't really have the most granular information on infection rates based on age. We have pretty general ideas of what it is for the under 18 population and the over 18 population. But in general, the infection rate for children right now is around, in this part of the state, is around 10 to 11% of those being tested are positive. So that's actually a little less than what it is overall in the state. Right now in the state, we're closer to around 13%. And at the height of the surge in South Florida, we were seeing rates upwards of 20% to 22% in children. So certainly off the highs of the summer. Unfortunately, the rate has sort of been trending up very slowly in South Florida in children, very likely attributable to more gatherings of kids, the openings of some face-to-face classrooms. So we're still watching that very closely. We're well off our highs, but we are seeing a slow trend upward. In terms of the MISC, which is the multisystem inflammatory syndrome in children, this was a very unexpected and unusual phenomenon in kids. As I mentioned earlier, kids don't get very sick in general from acute COVID-19 infections with pneumonia and the other things that we see in adults, but there are a small subset of kids that about 4 to 6 weeks later can get very ill with this out of control inflammation throughout their body that can involve their heart, their lungs, their GI tract, really any and every part of their body. The good news is that it's relatively rare. And so far, Joe DiMaggio, we've seen about 35 or 36 of these cases. I'm delighted to report they all successfully recovered with treatment. We don't really have the greatest numbers for how prevalent this is in the state, but just from talking to other children's hospital leaders throughout the state, I'm going to suggest it's probably around 100 to 125 cases that have been seen statewide. So very serious, very scary, treatable, unfortunately very rare.
Got it. Well, thank you, Dr. Ford. Again, I'm going to remind the audience, if you have any particular questions, please feel free to put them in the chat. Let's go over to you, Kenya, if you don't mind. First question I've got is, between COVID-19 and the protests for social justice taking place across the country, what are some ways that we can focus on our mental health during these uncertain times? And maybe before you answer that question, just to give a little context to the listeners, I've heard that the uncounted death toll from depression, suicide, drug abuse, I'm hearing statistics, I'd love for you to report on that is going off the charts. So we're all being confined to our own spaces and feeling lonely and stuff like that. Are you hearing across on a larger landscape that numbers are really escalating? And if so, then can you please answer, what are some of the ways that you could tell the audience to focus on your mental health? And
thank you for the question. So I'm just going to jump right in and say, in addition to or alongside of the global pandemic of COVID-19, there's also a shadow pandemic that is happening. People are feeling a large increase of depressive episodes and anxious behaviors, anxious emotions, and, you know, isolation is a big one that people don't even think of as being a trigger. You know, I think I've heard quite frequently across, you know, the nation, whether it's in conversation or in comedy, that people thought that, you know, a couple weeks at home at max, that we were going to be specific Floridians, because we're accustomed to reacting to hurricanes and responding to hurricanes. And so we frame everything in like 2-week increments. And when it became prolonged, I think people started to kind of look around and ask, like, are you okay? Because they were feeling not okay. And so to answer specifically, I think there are a number of things that are happening in our society, that are happening in our homes, that begin to compound and make everything seem very large and heavy. And then on top of that, you have folks who don't have access to their regular coping mechanisms or support system. And they are finding other ways to attempt to cope. And I think those are people that are really healthy, right? People who are emotionally intelligent and self-aware. But then you have folks that are not very self-aware or not very emotionally intelligent, or just don't know warning signs and symptoms of how to recognize challenges within themselves and others, and they are feeling turned completely upside down. And so in various spaces, and again, thank you to the Chamber and thank you to City of Delray and anyone who has invited me to have an open conversation with the community about what to do to manage. And it's very simple. It's if as much as you can, stay present in the moment. Be mindful. So if you have any mindfulness practices, if you are into prayer and meditation, whatever it is that you use to settle yourself and calm yourself, then go right to that. I actually personally, for my own self-care, started a Facebook community called Wander and Wonder, because I like to walk and talk. It's therapeutic for me. And so I did it alone. But there were others who, you know, joined in the movement and they started posting their pictures and things of that nature. But I will say, to answer the question, how to take care of your mental health during a global pandemic while racial tensions are high, you know, just be self-aware and make sure that you are checking in with those folks that you care for as well. Ask, how are you doing, and wait for an answer. And when someone can't give you an answer, then it doesn't necessarily mean that they're okay. It means that they may not be able to articulate what's happening. So stick close to your family and friends. If you are one of those people that are facing a challenge and you don't know necessarily who to reach out to, there are a plethora of resources. Healthier Delray Beach is a resource that can link you to whatever it is that you need. We hover in the community-based supports, but there's tons of clinical supports through websites like Birth to 22 can link you with clinical providers based on your region or area. If you're looking for more social community-based supports, again, Healthier Delray is a wonderful connector, a community-based hub for those things. And if there's specific things, again, my contact information is there. You have it, and I'm happy to talk anybody through, you know, a connection to what they need.
Thank you, Kenya. Appreciate that. I love the term shadow pandemic. It's such such a great way of describing it, because everybody's focused on the actual pandemic, but the shadow, the side effect is huge as well. And I know there's so much information and people are craving it. And the media's job is to always get eyeballs on the screen. We all know that, whether it's social media or traditional media, they get paid for more people that watch. And when people are getting information, it might oftentimes be more negative information to get more eyes on the screen. So just be aware of that. I always tell friends that are going through a rough spot to limit their intake of media, all media across the board. We have a beautiful Florida surroundings to go walk around, and there's nature and beauty all around us. So thank you for that. Now, Dr. Mylissa, I'm trying to combine as much as possible, but there's a lot of questions, and I know my own friends are always asking these types of questions. A lot of questions and confusions around the test itself, whether that's the nose or the throat, rapid versus the long one, and everybody has different opinions on it, whether you're symptomatic, asymptomatic. But I just know tests are not created equal. Although the school system and your friends may treat the test as equal, oh, you had a test, there's many different types of tests. And with the conditional approvals of many tests, I'd really like you to go into what type of test is the test people should be taking and how they are not all created equal, if you don't mind.
Sure. So yes, especially when it first came out, the first question, we were one of the first urgent cares to actually have the test outpatient. And originally everybody was very concerned about what type of test it was, whether it was approved or not. And now no one seems to care. Now they just want a rapid test. And as long as they have a result, they're fine. But it's true. They're not all created equal. There's a lot of different tests. So the sort of gold standard test is the swabs that you do from the nose, the PCR, that you can take a swab and it's cultured and tested. It takes anywhere from 3 to 5 days usually, but based on the sample amount, it can, as you saw during the peak, it took anywhere from 2 weeks to a month for some people to get the results back. That's the most accurate one. There's question of whether nasal versus oropharyngeal is better. The recommended is nasopharyngeal. However, the lab, based on shortages and everything, we're able to test the pharyngeal as well, and it was just as accurate from what we were seeing in our practice. In terms of the rapid tests, so these are approved now, but we've actually found in practice is that some people are getting negative rapid tests and then they come in and we do the PCR test and it actually ends up being positive. So there's a lot of question about the accuracy around all these. There's a lot out there on the market. They're coming out more. The original one, the Abbott, is almost impossible for anybody to get, but even that, the accuracy is not, necessarily perfect on that. But really the best one to do is the swab. Unfortunately, a lot of airlines and places are wanting swabs within a very short turnaround time. So people are looking for the rapid tests in order to be able to meet those criteria, which may be a little bit arbitrary and unrealistic if people can't get their results on time, especially because of the time constraints if you want the most accurate test. So those are really, like I said, if you get the swabs, that's really going to tell you for sure whether you have COVID or not. The rapid is a good quick test. If you're not having any symptoms, most likely it'll be negative and they're happy with those results, which seems to be the case. You can use that for that extent. But anybody who comes back positive on those or is having symptoms and has a negative test should go and have the swab done to make sure that they're truly positive or truly negative. In addition to that, there's the antibody tests. So the antibody tests tell you if you had it and have basically produced an immune system to it, but doesn't tell you necessarily whether you have it now. There's two different antibodies. There's IgM and the IgG. IgM usually shows up within 1 day to a couple weeks, and it's the early phase antibody. And then the IgG is the longer phase antibody that usually doesn't show up for about 2 to 4 weeks, but can last for several months to even years. So that's where your body, anytime, the way it works with antibodies is when we have an illness, our body starts to fight it and creates its own little army of antibodies that recognize that, so that if you are faced with that illness again, you have your ready soldiers know how to handle that and attack it. And that's how vaccines work as well, is to help your body produce your little army of antibodies so that when you are exposed to the illness, you either have no reaction or a much more mild reaction than you had if you're producing something for the first time in your body with no protection. So, but in terms of testing and who should get tested and when, in Florida, we've been pretty lenient about who we're testing and allowing at this point anybody who wants to get tested to get tested. The good news about that is it's easier to trace and know how broad and how widespread this disease really is. When you don't test people that are asymptomatic, you don't know how many people are carrying it and going around and spreading it without realizing it. The other thing we found, I know I found it at my urgent care with testing, is at the beginning, we were repeating tests every 2 weeks until people were negative because they needed a negative test in order to go back to work and to their life. People were not converting for a good month to 2 months. So we were getting live virus swab for 2 months. So the guidelines all say 10 days to 14 days, in terms of how contagious it is. But the question is it really only 10 to 14 days? Because I would think with the fact that this virus is still around, and after all the times that we've been in quarantine, et cetera, that when everybody comes out, the virus is still spreading, that this period may be longer than what's actually being projected and what's being stated as the recommendation. But I'm not privy to the information about where they're getting the research of deciding how many days somebody should be, or whether we're just kind of dealing with the realism of life and being able to get back to life versus really being able to knock out the virus. The good news is the cases seem to be getting less severe. So even though we're seeing spikes, and Florida has sort of been a model for this as we've gone back to life, is that we're seeing spikes, but I know that I'm seeing way less serious cases now than I was when it first started. So I think even though we're trending up, that's the direction it's going.
Really good information. And while you're talking, two further questions, and maybe Dr. Ford, you could jump in since we're kind of going down a little bit of a medical track for a second here. What do you do? Well, first of all, about the test, because I know a lot of the school systems will tell, parents that had exposures and children, you say swab, but I want to clarify for the listeners. Swab is the nasopharyngeal swab going down your nose to the back of your nose. And then there's the rapid test could be a swab of your nose, right? Like the inner portion of your nose, correct?
Sure, yes.
And so the problem is the local, communities are asking for tests, and people may have been exposed, and a day later they run out for a test and they say, okay, great, I'm negative, and they go back to school or they go back to their workplace. Can you speak to us about how long it takes from the exposure to the time that you can actually convert a test to a positive result?
Sure. Dr. Ford, do you want to answer that, or do you want me to?
I mean, I'm going to preface all the comments that we make from a medical standpoint is that we've been dealing with this for less than a year. So we learn new things every week and things that we didn't know last week. We didn't even know we didn't know the week before we learned. So what I tell my folks when I'm talking about new things that have come out, I said, I can guarantee this to be true at least until midnight, because you never know what the next day is going to bring us in terms of this. So in order for, what has to happen when you get exposed, in order for you to be positive for that test, there has to be enough time for that virus to start to replicate and reproduce itself. So just getting exposed to it and having, a minimal amount of virus present, it's probably not going to be picked up on the test. The virus has to replicate within the nose or the back of the throat before, and then the test will be sensitive enough to pick it up. That could somewhere takes anywhere from 4 to 12 days based on the information that I have. So getting a test the next day, if you're asymptomatic because of a recent exposure and it's negative, is probably would not be reassuring to me.
Got it. And just I know it's anecdotal, and I know it's just your own personal experience, but the listeners, I'm sure, and us are curious. Are you actually seeing, Dr. Ford, less severe cases? And if so, I know it's just your anecdotal experience, but what do you feel that is from? Do you think it's better treatment modalities, or do you believe the virus is getting less severe over time?
I do think that we're seeing less severe cases, and what I use to base my opinion on is really the number of hospitalizations and emergency department visits that we're seeing in our whole healthcare system, not just in pediatrics, but throughout all of the memorial health systems hospitals. When we were back dealing with this surge in July, there was a pretty steady correlation to the number of positive patients with the number of hospitalized patients, the number of patients coming into the EDs with flu-like symptoms, and ultimately the number of ICU patients. We haven't really seen that correlate quite as well with the increase in cases that we've seen, and hopefully that trend will continue. So anecdotally and based on that, I would say that it appears that the cases are maybe less severe, and whether that has to do with an alteration in the virus itself or a different strain, that's a little bit outside of my area of expertise, frankly.
Right, but I think the comment that was made by Dr. Graber, it's interesting because, like you said, Dr. Ford, this is such new territory. We literally have no idea, and unfortunately, we may have no idea for some time about what affects things. But there is a lot of comments about supplements and vitamin D, and right now with the media, you can find an article published today to say this is good and this is bad. Two different articles, rather, conflicting. So the public is even more confused, letting them feeling more hopeless and having to go towards the people like the professionals like Kenya to help them. So is there anything that you could say, Dr. Ford, before I get back to you, Dr. Graber, as for medical advice to the listener that's concerned about COVID, concerned about their children? Is there anything you can give, any advice or feedback to help allay those concerns and fears? carriers?
Definitely, but I can guarantee it's nothing they haven't heard before. You know, it's all about keeping ourselves at safe distances from one another, avoiding areas where people are congregating, maintain social distancing whenever possible, hand washing, the use of masks. All of those things we know make a difference. Now, when you get into supplements and things, yeah, you're right. You can find any given number of articles telling you one thing or another, and probably we won't know for some time whether any of those things really would make a difference. But we do know the best way to keep ourselves healthy is to protect ourselves, and not only protect ourselves, but we have a role in protecting others too, which is why, you know, if I'm not sick, I still, or whether I'm sick or not, to wear a mask, because source control is very effective, meaning that masking the person who is carrying the virus really helps to keep it from spreading. In addition to having that other person wear a mask, you have two barriers from this virus from going to one person to another. So I can just reiterate the things that we've been hearing for months on how to reduce the spread is the best way to keep ourselves and our families healthy.
Thank you. Dr. G, a quick question for you then, and Dr. Ford, please feel free to jump in. What is the most recent information that you guys are understanding as far as number or percentage of patients that are asymptomatic versus symptomatic? I know early on there were some studies to say that most were asymptomatic and they were carriers. What's the current consensus in the medical community about that?
Well, I still believe that most people are still asymptomatic. The most common symptom we're seeing is the loss of the smell and the taste, which is sort of specific to this virus, which I find very interesting. Is most of the time when people come in saying they've lost their smell and taste, they have COVID. You know, where there's such an array of symptoms that can go on with this illness that it's kind of almost crazy. Like when it first started, they're just saying, if you can't breathe, but you know, you have a runny nose, you don't have COVID. If you have runny nose, you don't have COVID. If you're coughing only, you have COVID. Now they've added sinus congestion to it. Then all of a sudden people were presenting with vomiting, diarrhea. So they were presenting with a whole other array of GI symptoms. Then there was the rashes that are coming up. Then there's people that have no symptoms at all. So it's so new and presents so differently in so many different people that it's been hard to say that whether or not. And I think in Florida, because I know in my practice, and this is anecdotal as well, we've tested whoever wants to come in and be tested. I find that what we had found is that most people that were asymptomatic coming in to be tested were negative early on. And then we found that we had a slew kind of back in July where a bunch of young people started coming in to be tested that had no symptoms or very mild symptoms, and they were all coming back positive. So we had this big peak when the younger kind of in the early 20-year-olds group were out, sort of going back in the world again. We saw a big trend around here of positives in that group. So they were asymptomatic or very mild, but that was a peak that we saw of tests going up, but we weren't having the same sort of seriousness that we were seeing originally. So when the virus first started, the cases that were coming in were really sick. We were seeing the pneumonias where they were coming in and they were hypoxic and they had the pneumonia, but they actually didn't look that bad. Originally, we were sending them to the hospital. Then we started giving them some medications. I believe very strongly in aggressive early symptoms. It seems like with this illness that when people respond, it's an inflammatory reaction. And so if you can prevent the inflammation early on, maybe you can actually prevent the later problems that happen in the disease. So when you were talking earlier about your vitamins and things like that, if they're anti-inflammatory based, it can't hurt you. Anything that's going to help with the inflammation could potentially prevent this disease from happening, you know. And so is it definitely, can I prove it? No, but just in terms of what I've seen in treating my patients, that anti-inflammatory vitamins, medications, etc., seem to make a difference in that impact. If they're young or they have no symptoms at all, I haven't been starting them on any medications unless they are higher risk patients. But sort of that's how you look at it. But in terms of the actual number of asymptomatic, we only know from the ones getting tested, it's still only, of everybody getting tested, it's still only about 10% that are coming back positive, and they're being tested whether they have symptoms or not.
I think what we've seen and what I've seen published, again, these are small reports, it's in children, it's somewhere upwards of 25% that have been asymptomatic. It's probably, I would suspect it's probably a good bit higher than that, you know, and that's one of the problems that's plagued us, no pun intended, is that, you know, this virus just goes through our communities silently and can be spread from person to person without so many being sick.
Especially because it lasts so long.
And it's also widely believed in the scientific community that if you're asymptomatic or mildly asymptomatic, I mean, obviously you could have a slight runny nose, but you wouldn't even know you're really not sick. And those people that are really not sick or not really feeling sick, they might just feel tired. Those people can spread it just as readily as a person who's coughing and all that other stuff. So that's, I guess, is that still widely understood and believed that asymptomatic patients can spread it?
Oh, definitely. And that's why I think that we're still seeing the virus going on to the extent that we are, is because of that asymptomatic spread and mild symptom spread and the long course of this virus in your body, that after, people are out there walking around doing their thing. I think the social distancing, the masking, that is helping somewhat in terms of, I think the best thing is social distancing, because obviously if you stay away from somebody, you're not going to catch something. Of everything else out there, social distancing, I think, is the most useful. Is just obviously if you're not around anyone who's infected, your chances of getting it are much lower, and I think that's huge.
Dr. G, you said something, I'm going to put you on the spot just for a second here. You said something about, the CDC recommends that 10 days after the cessation of symptoms, you're free to go back to the workplace and school and stuff like that. But you said something interesting. You said that you're testing patients, and seeing virus present, weeks after. So in your opinion and your anecdotal experience, does that also mean that those people could be shedding and infecting people post 10 days, even though they've recovered and they're no longer symptomatic? And if so, what are you advising people in your own private practice?
Yes, in my personal opinion, and like I said, I'm not a scientist, so I'm not sitting there in the lab to see exactly at what point it's infectious, but just the fact that they're not converting to positive on those tests for so long makes me think that it's possible people still are shedding some virus. As to what extent they're shedding it, I don't know. Maybe when you first get it within that 10 days, your viral load is much higher, and so therefore you may be shedding it more. But the fact that they're still positive for live virus, 6 weeks later, it makes me question the fact that maybe they are walking around and still able to spread the virus, which I think is why there is some of this push for the masks. Because even though there's question about the effectiveness in terms of the N95s are the true masks that will block the actual virus, where there's a lot of debate about whether or not wearing masks really do keep you from getting sick, it does help a little bit with that prevent of spread, especially if it's lower and smaller amounts of virus that people have in their systems. But yes, that's my own personal thought. And I do tell people, especially if they're high risk, or they're around people that are high risk, to stay away from those people until they're 100% sure that they're negative with the virus, because you don't want to be spreading it to somebody, that you love, or anyone for that matter, that is higher risk and make them sick. So even though you can go back to work, I highly recommend that they should be wearing a mask at all times and be taking those precautions even more seriously than others, because of the fact that they could potentially be a spreader of the virus.
Dr. Ford, do you agree with, is that your experience as well? Have you been testing and seeing? I know that you guys are not scientists, but it is very relevant for us to be listening to the people in the field. Scientists are not seeing what you're seeing. They're testing, and it's the nuance of actually how it presents in the community that's very valuable. So Dr. Ford, I'd love to hear your perspective on that.
Yeah, so this is still a hot debate. The information that we have about the ability for one person to infect another when they're positive, when they test positive, is based on fairly small studies, and many of which were from the initial cohorts, the initial groups in China and Wuhan. And so they were able to show that after a certain period of time, somewhere in this 2 to 3 week, maybe even up to 4 weeks, the risk of transmission went way, way down. Even if you still tested positive. And again, these were small, these were only, they weren't looking at thousands and thousands of people. They were looking at dozens or maybe 100 or 200. So the numbers are pretty small, and that limits how much weight a study like this carries. The test, the PCR test, the one from the nose, it really is looking for genetic material. It can't differentiate whether that genetic material from a virus is live virus or dead virus, whether or not that virus is able to reproduce itself or whether it's not. And so the theory is that these patients that are testing well past this 2-3 week period that are testing positive have residual virus or genetic material there that's not capable of infecting, but the test is so sensitive it's going to be positive and pick it up. And I think that is where people are leaning. Again, we really just need more research and more information to be able to validate that. And that's why it's still you know, somewhat contested. But I fully agree with Dr. G's point is that mask. Wear a mask. That's, I mean, whether, regardless of whether you're able to infect or not, or don't know whether you're able to infect, wearing that mask dramatically reduces the possibility that you will.
Thank you for that. I'm going to jump over to Kenya for a second here. We've got a lot of questions surrounding, I'm going down a rabbit hole of worst case scenarios. What can I do? I'm staying home. I feel lonely, isolated. What can I do? I can't stop worrying. What do I need to do? And I'm going to put that kind of together, those feelings of helplessness or hopelessness together with this other part of the question too, that you often hear it's important to remember to take care of yourself and give self-care, but it feels like that gets expensive quickly. So what are some inexpensive ways to give self-care? So speak to the person that is actually not sleeping, going down the rabbit hole, can't control their mind, and they're in a bad space. And how do they do it in a cost-effective manner to get help for themselves?
Great question. I would say, you know, for those that are, you already made mention of it, limit the time that you're in front of the television because it's repetitive information. And, you know, facts over feelings any day of the week. Stick to the facts, talk to the professionals, plug into credible resources. And when you feel like you are not yourself, those persons that are feeling like they're going down a rabbit hole, or those persons that are just feeling not themselves today, don't delay. You know, phone a friend. If you already have a therapist, reach out. If not, you know, plug into those community-based resources. I simply say you should not delay in waiting to address it. It's not going to wake up and be different the next day if you don't face it. So I'm seeing some things here in the chat box, even, you know, breathing exercises and meditation, you know, those are the things that I mentioned already. But in essence, it really just means doing something that will bring you some peace and bring you some relief. And there's a whole spectrum of challenges that a person can face, from being, you know, thriving and well and managing all the way to being in crisis. So there's also a continuum of supports that persons can plug into. But simple things that you can do is do not hold it in. Do not, you know, feel like you are alone. Don't put yourself in a box, in particularly, you know, thinking that you're the only one that's feeling that way, or someone will think ill of you if you express how you're feeling. We are in very unprecedented times. I have heard that said countless times since we've been on this call here. We are in unprecedented times medically, which also means that in a mental health support space, in a behavioral health space, there are also some unprecedented things that we're seeing. I have close conversation with clinicians that are serving the community, and Healthier Delray actually holds a support space for those individuals, because everyone who is now seeking the support of a therapist, those therapists need support. They're people too. So even in those conversations, they're telling me that the symptoms and things that people are presenting with, they're mimicking other things. When we talk about trauma, the effects of trauma it's all encompassing. And so folks who are losing loved ones, folks who don't know that they are going to see their loved ones again. Jeff told in his story how he kissed his wife quickly goodbye and didn't know that he was not going to see her again for 30+ days. There's psychological effects on both sides of that. And so, you know, the things that we're going to see, the things that we're going to feel and experience, we have to destigmatize what we see presented in front of us. Realize that we're dealing with real life, actual human beings who have emotions and feelings, And if someone is having a hard day, you know, give them credit for having a hard day. You know, I'm so grateful that, you know, I'm really proud of Delray. Like, I live and work and shop in this community, and I've seen a tremendous swell in compassion and kindness and, you know, patience. Even with simple instructions of following instructions of go this way, go that way in the grocery store, you know, I see people being mindful of all of those things, social distancing, and let us not forget that there's a disproportionate rate of things happening in communities of color because of access, because of pre-existing conditions that are not, you know, just genetically, culturally disproportionate. And so, you know, there are cultural norms that everyone is experiencing, and even how you're laying your loved ones to rest. So you never know what someone is facing, but please understand that there's an answer, there is support, there is treatment for it all. And you do not have to suffer in silence. You don't have to suffer at all. You know, we are here, the behavioral health community, the mental health community, we are seasoned, we are prepared. And I did not get a chance to say when I was introducing myself, I'm a clinician as well. So I would just say, check on your people. Don't be afraid to ask for help, seek professional help, and be mindful of yourself. Know yourself.
Oh, that's beautiful. Beautiful,
Truthful
Kenya.
about it.
Sorry, say that one more time. I stepped on you.
And be truthful about it. Don't wear the mask. Wear the mask, but don't wear the mask.
Yeah, suffering in silence is probably the greatest thing. Those were beautiful words, Kenya. So beautiful, because I think those that are feeling most down feel alone because they feel they're the only one suffering, and suffering is part of the human experience. And give yourself some grace. Allow yourself to be emotionally aware and say, this does not define me, but this is how it is in this moment, and I need help. And there's no shame. And from a cultural standpoint, there's another shadow pandemic. It's pointed out the inequalities in our community. This has been put a big highlighter over, different types of communities being adversely affected. It shows years and decades and potentially longer of inequality from a healthcare and access standpoint. So, and
I just want to just jump right back in there real quickly. Healthier Delray Beach and Healthier Together initiative has been involved in work of this nature, grassroots, and we talk about things like the social determinants of health and the root causes of trauma and violence. And so here we have a merger, and we're living it, real time, because we've been talking about it, sharing and advocating with systems for at least 5 years of our existence. We are in year 6 now. And so to have an opportunity to come into places and spaces like this and share that, from a experiential and research-based place, that the disproportionalities do exist. They are very real, and they are impacting people at a disproportionate rate. And so I can't bring awareness to that enough. And also, someone asked about cost-effective measures, because counseling does get expensive if your provider does not take insurance, nor if you carry insurance. But there are a bunch of free resources. There are even telehealth sessions available if you're not comfortable leaving your home. There's all types of answers or solutions to the challenges that you face, or any barriers. So once again, because we are limited for time, people should be reaching out individually, and I can share some solutions for individual challenges or scenarios or circumstances, because we are really pressed for time. But this conversation, this information is vital.
Agreed.
Go out.
Thank you, Kenya. We're really lucky to have a person like you in our community, and please take care of yourself too. All these caregivers, you need
I try.
On the plane, they say put the oxygen mask on yourself first, because you're in service to the people that are here in the community. So please take care of yourself. Quick question to Dr. Ford. I'm going to pivot real quick. From a patient standpoint, from a parent's standpoint, what is the risk level of allowing my toddler to play at the park? with trying to maintain social distancing and ensuring hand washing immediately after, but toddlers, children, they don't get it. And even though you start off probably with really good intentions, 5 minutes later, you look down at your phone, you look back up, and the kids are hugging and runny noses are flying and all that stuff. So what do you think about that?
I think it can be done. I think it can be done safely. You know, I mean, socialization is so important at that age, and we want to try to give them opportunities in a safe way to be able to socialize with one another that is healthy. And but you do have to be careful. There are no guarantees. You know, again, because so many young children are asymptomatic and can't transmit the virus to one another, and they don't have the ability, you know, that age really to understand social distancing. There's too many things pulling them toward each other to try to convince them to stay apart. So, I mean, I think it's a kind of a risk-benefit judgment each parent has to make. You definitely don't want to do it on a crowded day. You definitely want to try to make sure that hand washing is frequent, or using the hand sanitizer, which works in cases of for coronavirus. And just be very watchful. There's no guarantees, but I think it can be done safely.
Got it. Thank you for that. Right now, we have a pre-recorded session from Dr. Daniel Goldman that I want to go through real quick. It's just a little bit under 2 minutes, but I just want to make sure that he gets his time here. He couldn't be here. But the questions that were asked were, how do you think telemedicine will change how doctors work with patients, and so on and so forth. So Stephanie and/or Angelica, if you could go ahead and play Dr. Goldman's video now. Thank you.
We do have some questions that have come in from the community. The first one is, how do you think telemedicine will change how doctors work with patients in the post-pandemic environment? It's a great question, and I think it already has changed the way we're dealing with patients. Telemedicine has been around for many years, but it really caught on with the pandemic when folks couldn't get out, particularly older patients who didn't want to use telemedicine, and they are really embracing it. We have a very sophisticated system in all our outpatient practices, and in addition, Baptist Health South Florida has a special product called Care on Demand, which is really wonderful and provides a lot of care and live video feed during the visit with the providers. Another question is, what are the most current findings on how long COVID antibodies last? Also a very good question. It appears that after about 3 months, the antibodies start to die off, but how low they get, we don't know yet. It's too soon to say. Remember, this is only a disease we've been dealing with since February or March, so there's a lot to learn. So another question is, how has the Bethesda staff, along with Baptist Health South Florida, dealt with the pressures of this pandemic? There's no question this is a high pressure environment. There's no question it's emotionally charged, with some very young patients being very sick, being intubated for long periods of time, requiring a lot of attention from the nursing staff and from everyone else. But we really pull together as a team here. There are options both at Bethesda and Baptist Health if individuals want to talk to anybody. There are daily huddles held on all the units, and a very supportive administration as well. And I really think we have, again, pulled together as a family and truly shown that it does take a village to take care of each other and to take care of our patients.
So I'm very appreciative of all the panelists and being generous with their time here. I'm going to quickly pivot, and because I actually have a patient to take care of, but that doesn't mean that we're over, so no one go away. I want to thank you guys for being with us today. It was really an honor for me to be called to moderate this. It's really comforting to know that we have this beautiful community that we all serve, and that we're all aligned and helping each other in all of our own unique and special ways. So I'm going to be handing over to Stephanie to continue this onward as long as people have time. So appreciate you all.
I want to thank you too, Dr. Craig Spodak, for doing this. We knew you were the perfect person to moderate this for us, and we're very appreciative of you, and of course all the panelists. I'm getting verklempt right now just with all the love that we're feeling going around. So thank you, Dr. Spodak, and we'll talk to you soon.
Thank you, everybody.
Okay. So yeah, we've been going on, it's for an hour and a half now, so we're probably going to need to wrap this up, but there's a ton of interest, obviously, that we're getting both on our Facebook page and for the participants now. So I'll just say a couple of things, and then we can point you all to more information. So in May 2021, that's going to be our Health and Wellness Month here at the Chamber. So we're going to invite our same panelists back, I think. You're invited. And hopefully we'll be coming out of this and we can talk about, you know, what we learned from it. Hopefully there'll be a vaccine available, and we can definitely have a discussion on that. So May 2021, we'll have another Health and Wellness Symposium. So there's so much information that was relayed today that you can replay this. It's on our Facebook page right now, the Greater Delray Beach Chamber of Commerce Facebook page. We'll upload it to our YouTube channel, and we'll also upload it to delraybeach.com/webinars. That's where you can find all of our webinars. And we're talking a little bit about mental health awareness. Thank you, Ken. You just put that in there. One of our original Lunch and Learns that I think is on the webinar page was a mindfulness webinar that we did, because even early on in this pandemic in April and May, people were struggling. Everyone that I know has gone through a moment here and there. So I think that we have that on our webinar page that you can take a look at. And if you'll take a look in the chat too, a lot of resources have been made available. So 211 is a great resource that if anyone's having any type of issue, they can always call 211. I think the Joe DiMaggio website is also up there as well, especially as relates to children. So you're going to probably want to see this again and review it and review the chat, and you have ability to do that. Panelists, is there anything else you want to say to wrap up? Dr. Graber, Dr. Ford?
So yeah, I just thank you again for this opportunity to share information. This is a great forum, and I'm glad you're going to have more of them, because for the next one, we may have a very different story to tell, especially if we have a vaccine, and we look forward to see how that's going to impact our communities and to make us healthier. And I do want to just emphasize, I did put the link for the parent resource area of the Joe DiMaggio Children's Hospital website in the chat box. There's a lot of good resources on how to talk to your kids about the pandemic, how to be safe at home, how to be safe when you're not at home, and just how to take care of the whole family. So thanks for the opportunity.
Thank you.
And yeah, thank you very much for allowing us. We're here in your community. Dr. D's Urgent Care, we're here for you. So if you guys have any questions or just want to come in, we're obviously doing testing if you need us, and stay healthy, everybody. Thank you.
Okay, so last of all, there's a ton of people to thank you. I'd like to thank our sponsors again. I'd like to thank Bethesda, CDS, All About Florida Homes, Lane Realty, and Derma Vitality. We couldn't do it without you. And basically, the interest we're getting, we may have to do another one before May, I have to tell you. And again, thank you to our amazing panelists and the moderator. And thank you to all of you, our chamber members and our community, for tuning in today. I hope you found this helpful. And last but not least, Jeff Perlman, you're an inspiration to us all. We really appreciate hearing from you. So thank you to everyone. I hope I got everyone. And we'll see you soon again.
Thank you. Thank you so much.
Bye, everyone.